I can't think of any period in time that the clinic, since its inception, hasn't been just such a really important part of the whole community. They've always been there. It's really a very comforting place to be able to have your medical care.
People that provide health care have always been very valued members of this community, because people realize that, you know, somebody who's chosen to live here as a profession, you know, how many years it takes to become a doctor or a physician, people sometimes give up that opportunity to make huge amounts of money, as they would if they become specialized or they're working in a larger citywide organization.
Over the years, Cook County has benefited from the service of some very dedicated physicians, starting with Dr. Tom Mayhew in the 1870s. Dr. Roger McDonald is credited with starting what is now the Sawtooth Mountain Clinic in the early 1960s.
I started medical school January 1944. I interned in St. Luke's Hospital in Duluth in 1947, where I met my first wife. She was a member of the Grand Portage Band of Ojibwe Indians, and was an RN working in the obstetrical suite. First came to Grand Marais in the fall of 1947 to meet her parents.
In the early 1900s, Cook County's healthcare needs were met by patients driving long distances to hospitals or by a doctor who was willing to do house calls. But as the county's population grew, the healthcare needs of the community started to outgrow what one physician could offer.
The need for health care doesn't go away. Just because you live out in the wilderness, you really need to have a place where you're able to take care of things.
In response to this increasing demand for accessible health care, with strong community support and monies from the Hill-Burton Act, the first hospital in Cook County was built in 1959.
I got a phone call one day from people here at the hospital asking if I was interested in coming over. So I came over, met with the people. Sherm Benson was the chairman of the hospital board at that time. And he and I had a couple of conversations, and I met with the hospital board, and we worked out a solution.
The solution was a small building near the North Shore Hospital built by the Backlund brothers in 1962.
I can remember it as this very small, kind of inefficient little office, which is now near the parking lot, the northeastern parking lot, and very small waiting room. You didn't get that sense that there was much privacy going on because it was so condensed, and it was always kind of hectic.
Being a solo doctor is so difficult. And again, in a town like Grand Marais, goodness sakes, the population doubles, quadruples, I don't know the exact figure. Tourists, summer residents, compared to the winter population. And I knew I couldn't take care of it all. Just imagine, we've got an office with 10, 12, 15 people already waiting in the waiting room, assuming that they had an appointment to get in any time in the next 2 or 3 hours. Then some catastrophe is brought to the emergency room right across the driveway, and I have to run over and take care of that. Then whatever mayhem might have happened during the night, we had to come and take care of that too. It was exhausting. I figured out one night while I was waiting for a woman to have her baby, I had spent more than 10,000 nights of my life on call.
Dr. McDonald's predicament was not uncommon. Fortunately, the government took notice of this disparity and started, in conjunction with the University of Minnesota, the Rural Physician Associates Program, or RPAP.
My good fortune was to have become involved with the RPAP program because my first medical student under that program, Dr. David Hilfiger, came back to practice with me after he finished his training internship. And he brought with him one of his classmates, Dr. Bill Galley.
Dr. McDonald's clinic went from having one physician to 3 overnight, making day-to-day practice a little more manageable.
But as healthcare progressed in the evolution of healthcare and it grew, they were just not receiving the payments they needed. The small general practitioners who were struggling. There was a period of time where HMOs, health management organizations, started operating in Minnesota. They went around to various facilities in Minnesota and basically bought out the small general practitioners who were struggling.
These people came over and wanted to buy me out and run the practice. And I was certainly not opposed to the concept of an HMO. And so I sold the practice to the HMO people.
So Group Health of Minnesota went around and actually purchased several clinics, mid-70s, and they operated, I want to say, for approximately 6 years here. But because we're such a small community and our numbers are finite, our populations plateau, being by the definition of rural, they too could not make ends meet. They gave notice to the physicians that were here that they no longer were going to service the communities. And so by that time they had signed up almost everyone in Cook County, and I think Grand Portage Reservation also as a member. And so they had large numbers. So when they left, virtually everyone was once again uninsured in Cook County.
Unwilling to let the residents of Cook County lose their accessible health care, the doctors began to brainstorm clinic models that would match the needs of the area.
And Dr. Hilfiger took it under his wing to work with Dr. McDonald to look at all kinds of options. How are we going to make this work? Because indeed, healthcare does need to survive. A clinic does need to be in existence here to serve the hospital, Cook County's hospital, North Shore Hospital, as well as the community members. So Dr. Hilfiger learned about this granting source in Washington, D.C., and it was called Rural Health Initiative. So he researched it and found out that he could write a grant. So he wrote a grant to this agency out in D.C., which was the Health Resource Service Administration, known as HRSA in D.C., and was awarded a grant, which was our first federally qualified community health center grant.
This HRSA grant made possible a clinic model that allowed the doctors to focus on patient care rather than worrying about how to keep the doors open.
One of the reasons that we qualified as a federally qualified health center is the fact that we're remote. That hasn't changed. We've always been remote, even though, we're now no longer inaccessible. There was a time where it really was inaccessible. There was a time that you could only access the shore by boat, and then there was a series of roads, and even the accessibility in 1951. I remember my folks talking about having to drive down in the middle of March, and in a snowstorm, and the roads were bad.
When I first came, the facility was a very tiny little brick building that had been built by the community for Dr. McDonald, and it was around, I think, 3,000 to 4,000 square feet. And as we move forward, realizing that perhaps we could serve more, we could become not just a little clinic, but a clinic where people came to learn about nutrition and came to learn about moving and the value of being active. And I can learn about taking care of my child and my children better. I can learn about parenting skills better. When we learned that we could have more than one physician, I think then we began to realize that we needed a larger space.
In 1995, construction of a new facility was completed, allowing the clinic to better meet the varied health needs of its community.
A clinic does not need to be just a place you come to when you are sick, but a place you come to to learn how to be healthy and to stay healthy and to feel very safe, to know that your neighbor's taking care of you and cares and really does care about your child and really does care about your parents and your grandparents. I think that's been, for me, a really very strong, beautiful part of being a community health center in our community and really knowing who we touch.
It's something that people that don't live in remote areas take for granted. People can rest easier. It's been a lot better having medical facilities here. It's really the backbone of the whole community.